Off the top, though, we have 3,098 cases of coronavirus in Victoria. That's 165 new cases. There's some reconciliation in the data, so the global number's only gone up by 156, but there are in fact 165 new cases. 30 connected with outbreaks and 135 that are under investigation by our public health team. There are 477 cases of community transmission, 932 active cases across the state. 40 Victorians remain in hospital, with 9 of those in intensive care. Given it was the last day before the stage 3 restrictions were reimposed, it's not surprising that our test numbers off the almost 30,000 yesterday were back closer to 22,000, 21,785, but that takes us to 1,030,462 tests since the 1st of January. Again, I want to thank everybody who's come forward and got tested. I want to thank everybody who is out there following these rules. We know and understand it's difficult, it's challenging. No one's enjoying this. Nobody wanted to be in the position that we're in, but we simply have no choice as a state to follow the rules. And even in regional Victoria, there are still rules in place, and they are just as important as following the rules in metropolitan Melbourne and Mitchell Shire. If we don't all play that part, if we don't all continue to work together and take this as seriously as we have to, then we simply won't bring stability to these numbers, let alone drive them down and get to the end of this 6-week period and begin and then recommence the process of opening up. So everything is on the line here, and we need to make sure that we're all playing our part. And I want to be really clear to thank the vast majority of Victorians who are taking this seriously and are working with us to get this job done. As I said a moment ago, nobody wanted to we didn't want to find ourselves in these circumstances, but this is where we are, and we have no choice but to confront the reality of this virus and its transmission across the community, and to take the very difficult steps that we've taken, and then all of us to adhere to those rules. Our Victorian community benefits from that, your local community benefits from that, your family and every family benefits from that in so many different ways. Ending these restrictions sooner than would otherwise be the case. If we don't drive these numbers down, then 6 weeks can become longer. If we don't take this seriously, then many people will become gravely ill, and then we know the tragedy that follows soon after that. So for all of those reasons, and many more perhaps, I want to thank those who are doing the right thing, and I want to appeal to all Victorians. Let's keep working together. Let's keep taking this seriously. We simply have no choice but to do that. Now, in terms of the towers, we have conducted some 2,515 tests, which is a massive effort when you consider the challenge of moving up and down these high-rise towers, the sheer amount of work that's been done to get those tests taken and processed. There are 159 positive cases out of those tests. There are also a number of close contacts. There are, in essence, 3 groups within those 9 towers. I'll ask Brett to speak to this in more detail, but essentially 9 Pampas Street and 159 Melrose Street both have 0 cases and will be able to move to the stage 3 restrictions that apply to the rest of Melbourne. Home, except for the 4 reasons. Now, acknowledging that this is in some respects akin to an aged care facility, there will be continued support and continued protection for those residents, given that their age and for many of them their health status makes them especially vulnerable. Beyond that, we have another 6 towers that have relatively low numbers of cases, and then we have 1 tower that has very substantial numbers of cases and potentially close contacts right throughout that tower. To take you through the science of this and the different approach we're taking to each of these 3 groups of towers, I'll ask Brett to speak to that now, and then that's the what we're doing and why, and then I'll ask Lisa Neville, who is essentially in charge of our response on the ground, to explain to you how it is we will get that job done.